Today's topic is appendicitis. Appendicitis is a condition where the appendix is inflamed, swollen, or filled with pus. The appendix is a small tube of tissue that projects from your colon on the lower right side of your abdomen. Appendicitis pain increases and gets intense as the inflammation worsens. Anybody can develop appendicitis. However, it is more prevalent in people between the ages of 10 and 30. If left untreated, inflamed appendicitis can burst or leak, spilling infectious substance into the abdominal cavity. This can lead to a severe inflammation of the abdominal cavity that can be very bad unless treated.
Firstly, nurse will insert granula to give IV pain medication to cater patient's chief complaint, which is the pain at the right lower quadrant. After successful cannulation, an adequate blood sample also will be taken to minimize chance for poking patient again afterwards for blood investigation. The doctor will do detailed history taking to gather subjective data from patient and also relative. Sample questions will be asked containing of signs and symptoms, allergies, medication, pain, last meal and also environment.
Patient's right lower quadrant while in a supine position. Isolate the ASIS and umbilicus and palpate for tenderness halfway between these 2 points. palpation will produce pain or tenderness. The rebound tenderness test should also be performed to help rule in appendicitis. To perform the rebound tenderness test, place your hand on the abdomen above the suspected area of inflammation. Palpate deeply and slowly, then quickly remove hand. Pain will occur from the quick withdrawal and rapid movement of inflamed tissue. If rebound tenderness is present, the patient will report pain or increased pain on the site of inflammation when the hand is released. Ask the patient if pain is felt on palpation or during the release. This may be uncomfortable for the patient, so you may want to save it for last when assessing pelvic or abdominal pain.
The doctor will order nurses for diagnostic investigation to confirm patient's diagnosis before giving further treatment to the patient. Let's see what the plans in the yellow zone. Treatment by mouth, IV fluid normal saline for maintenance, pain medications such as tramadol, anti-emetic, metoclopramide, proton pump inhibitor such as pantoprazole, paracetamol for fever, blood taking and also investigation, the last one, ECG, CT scan and X-ray. During the administering medication, make sure to check the 7 rights before administering medication to patient regardless of patient's condition. Next, explain the ECG procedure to the patient. Then, don't forget to explain about the CT scan and X-ray before pushing them to the procedure room. The doctor will share the diagnostic findings and plans of treatments with the patient and also relative. Let's see what the plans for patients with non-perforated appendicitis. For appendectomy, surgery later, antibiotics before surgery, treatment by mouth, pain medications and also paracetamol for fever. Plans for patients with perforated appendicitis, treat the infection in the peritoneal cavity with antibiotic. If collection happen in the cavity, drainage of pus will be done. Once clear, doctor will plan for appendectomy. Nurse from emergency department will pass report about patient's condition, diagnosis and plans to the staff nurse in the ward.
ฉันไม่รู้ว่านานเท่าไรจะได้พบความจริงในใจจะเจอความรักที่ไม่เคยคิด